Body image disturbance is a clinical phenomenon in which patients experience excessive concern over perceived physical flaws that are not noticeable to others. In aesthetic medicine, such patients often repeatedly seek consultations, believing that a procedure will resolve their emotional discomfort. However, these demands may be rooted in deep perceptual distortions involving cognitive, emotional, and behavioral components, which do not meet standard clinical criteria for safe aesthetic intervention. BDD is marked by a distorted perception of one or more specific body areas, accompanied by avoidance behaviors, low self-esteem, depressive symptoms, and social isolation. Unlike eating disorders, EDs, which focus on overall weight or body shape, BDD often centers on specific regions, such as the face. Diagnosis is complex due to limited patient insight and the tendency to conceal symptoms out of shame or fear of being labeled vain. Common comorbidities include depression, social phobia, and anxiety disorders. A comprehensive evaluation must consider 4 dimensions of body image: perceptual, emotional, cognitive, and behavioral. Recommended tools for detecting BDD include the BDD-YBOCS, which assesses symptom severity over the past week and focuses on obsessive thoughts, repetitive behaviors, and social avoidance. Other useful scales include the BSQ, BIAQ, and body silhouette drawings. Assessment should be integrated into a semi-structured interview, especially in patients with repeated demands and unobjectifiable complaints of deformity. In suspected BDD cases, aesthetic intervention is contraindicated as it does not resolve the underlying conflict and may worsen it. The aesthetic physician must proceed with caution, avoiding direct confrontation, and instead prioritize a respectful, collaborative referral to a mental health professional. Cognitive behavioral therapy is the treatment of choice, focusing on dysfunctional thoughts about appearance, self-esteem enhancement, and reconstruction of body self-image. Early detection and interdisciplinary intervention are key to preserving the patient's emotional health and the ethics of medical aesthetic practice.